I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo, Lebo Gyno and beyond. But today we're just doing Lebo Gyno, just bilateral gynecomastia gland removal. He's 35. He's from the Miami region. Flew in last night, and he's here this morning for the bilateral gynecomastia gland removal surgery. Now, you know, I was giving him crap about his posture and stuff. So arms back. I think he's got to build up a little chest there. You know, build up a little. You know, just kind of shred a little bit, and build some muscle, and lean down a bit. But really bothers him is the gland removal. You don't, on this guy, you don't want to do liposuction. If you do liposuction, you're just going to ruin the natural, you know, beauty of a chest. Now make a muscle. There, see? Nothing. See, you see the striations, see that? There's no fat there. So there's really no reason to do lipo. And as a matter of fact, I just did a guy from Austin, Texas, who probably didn't need lipo, had in Austin lipo and gland removal with an over resection, and we had to go back in him. And we did a beautiful job, but we had a lipo and fat graft and skin tight because we needed, and we put in almost 400 cc's in one pec and like over 300 cc's in the other pec to recreate the natural beauty of the pec muscle from, you know, having unnecessary surgery. That said, with this guy, just gland removal, again, my wish for him is to build muscle, lose baby fat, and he'll look great. And that's all I got to say about that. We're doing it under local anesthesia. Let's go. About a week. Lift up your arm. So, we did the midline. That's the pec muscle there. And again, he does not need, I can see the serratus muscles. So this is kind of ground zero, right about there. That's about ground zero, basically. So we're gonna do some nice numbing, done under local. We don't have to, you know, just numb up this. It's easier than a root canal, basically. Numb up the area, simple and easy. And get this mama out. You never have to worry about it. Get it all out. At least 98%, 99, you know, and so he can get himself on testosterone if he wants. He can do whatever he wants. He'll never grow back, and that's it. A nice tight teeth.
Listen to me now. We can very easily. You are.
So I grab it, get my needle, a little pinch. He's fine. He'll live. And we pump you. Oh. So what I'm doing, I'm under the gland, over the muscle. And I'm just numbing this, really the heck out of it. I want him to feel nothing. Okay? A little pressure? Very nice. Come over here. Go to the head of it. Good. Nice. Beautiful. Let me have a blue towel. So make a little incision where I say where the water meets the beach. Slowly, gently, not forcefully, just very delicate. I should be seeing the whiteness, That's the beauty of the local. Should be seeing the whiteness of the gland compared to the amarillo, amarillo of the fat. So that's the amarillo, and the gland is blanco. You speak Spanish?
Yep.
Yep. All right. Only Spanish being spoken from now on. Randy, I speak Spanish. So getting underneath the gland. Sorry. You can't answer it.
Nope.
Should have told you to silence it. It's all right. Nobody's going to answer it. All right. So next, let me have the small scissors and the bigger pickups, and let's get There it is. So you can kind of see the gland, which is the white. So what I'm going to do is start here. Let me extend just a little bit. Separating right there. Now, pick up it, and I want to save all the fat I can. I'm going to get that out, but do not want to over resect. There we are. That would be bad. No bueno. Good. Good. Let me just get So the beauty of this is I'm not using cautery. I will use cautery later, but I'm not using cautery to dissect. I'm doing it by cold steel. Now lift up the arm a tad. Give me a little flatter surface. Good. Perfecto. That's the gland, mainly. Not that big.
Oh, is it?
Yeah. And I'm gonna get, yeah. That looks beautiful. Now I need to contour some of the fat. Perfect. Flip Mr. Nip. So, now, yeah. Yep, well, now I'm going to contour some of the fat. without lipo, because lipo would destroy. Yippee, yippee. Nice. Okay. A little bit. Good. Yeah.
You get a packet?
To contour around. So now I'm contouring it directly rather than just destroying it with lipo. And over resecting you. That looks great. We're going to do it again with the cautery a little later, where the water meets the beach. Good. Okay. Nice. Okay, get underneath it. Lift up the arm just a tad. Give me a little flatter surface. Good. Excellent. Nice. Good. Start to get the yellow. Not that he has got to lose weight. What do you weigh? $150, you said?
We 155.
Yeah. I think you just have to tighten up a little bit. Build muscle, lose fat. But of course, muscle weighs more than fat, correct? So, by building muscle and losing fat, you'll actually gain weight, but you'll look fitter. Here, let me have the bigger scissors. Thanks. So, just scouting out underneath the nipple. Good. Get to the side. Let me get under it first. What side do you think is a little bigger? Do you know?
I think that side is a little.
I think you're right. So again, I'm looking for everything white. Blanco. Nothing amarillo. Amarillo? Mm-hmm. Am I saying it right? How do you say it, Randy?
I can't say it.
Yellow!
I don't even know how I passed my Spanish regions. I failed the oral part, but I ended up getting like an 82 on the regions.
Really?
Oh my God.
Yeah,
Maybe you can read better than speak.
I guess.
Yeah, this is more of a gland. Here's side two.
Wow.
Then we're gonna go back and forth. Don't worry. Don't worry, it's fine. If this gland is bigger, I will contour that side to match this side. Don't you worry, that's why I go back and forth. Nice. Get in there. All right. Yeah, have a nice little pocket of gland, lateral, more of a head to it. A tail, sorry. Alrighty, lift up one more time this side, make it a little flatter for me. Get in there. I want to just.
Oh, sorry.
It's your never have the pointiness towards the other person. Perfect. I'm gonna flip Mr. Nip. If I come down just a little bit, give me a little room there to flip. Good. There's a little whiteness right there. See that?
Mm-hmm.
See the whiteness there?
That's gland.
That's gland. Can't leave that. A little whiteness there. Good. That's great. This is good. Let me have the retractor. A little stalagmites and stalactites hanging out. Good. Here, hold this one. Dr. Lebo Gyno. So 35 from Miami, 35-year-old young man from Miami. We did bilateral gynecomastia gland removal. That just bothered him for, since puberty. He's thin, 155 pounds, 5'7", something like that? 5'9". Everybody's bigger than me. So we removed it under local anesthesia, stealth incisions where the water meets the beach. We got it out perfectly. So now this is the right side. The right side was mainly fatty and some gland. The left side was mainly gland. So it's interesting. They both bothered him. He knew that the left side, which is this side, was bigger than the right, but the gland on the left side was more formed and pronounced. The right side was more fatty. So we contoured it to perfection. We did the gland removal and we did a natural blend technique to make it look amazing. We closed it up with all internal stealth sutures. I did my internal quilting stitches to close up the space and to tighten up the pectoralis major muscle. And then we did the internal stitches for the nipples themselves through a little, tiny little stealth incision, as always. no drains, perfection. We're gonna send these glands out to the lab. That's kind of rules now in New York, and we're gonna dress him up in a second and see him tomorrow. And see him, which is Saturday, which I have a surgery on Saturday, and then Sunday, and then he flies back to Florida, to Miami, on Sunday after I see him. So if you have gynecomastia, just, trust me to do it right the first time. Resist the temptation to go somebody not as good as me, local, because I fear that, and I do a lot of botched repairs, that you might be disappointed. And I go beyond with the best technology, the best technique, safe and comfortable, and dynamically under local anesthesia. So if you have gynecomastia, call me Dr. Lebo Gyno, 631-424-0101, or email me at JonathanLebowitzMD@gmail.com. Let's go.